is now absorbed by the enterocytes. Do you understand? It goes into the cell, right? When I say enterocyte, I'm talking about the cell of the gut. Are you there? It goes into the cell, but it passes through a channel, right? It passes through a channel. What do we call that channel? Or transporter. It passes through a transporter. What do we call that transporter? This is a transporter. It passes through this transporter and enters the cell. This transporter is called DMT1 transporter. DMT1. That is divalent metallic transporter 1. Divalent metallic transporter 1. Right? Don't worry, I will not bother you with this info. I'm just teaching, right? I don't expect you to, but you can know it. If you're a smart student, you can know it, right? So DMT1 what? Ferrous iron will be transported by this channel or transporter into the enterocytes. Do you get it? Now, in the enterocytes, what will happen? What will happen? Iron will come out, right? It will come out. Do you understand? It will come out. In trying to pass through capillaries, what will happen? They begin to rupture. And when they begin to rupture, the number of arrhythmias will come drastically reduce. And when it reduces, is it coming up? When it reduces, what will happen? Anemia will set in. Do you understand it? Do you understand it?
Yes.
I should come again. I said a macrocytic pneumochromic anemia, the cell is enlarged. Do you understand? The cells are enlarged, right? Are you there? And then, but the hemoglobin concentration is normal. Macrocytic pneumochromic is normal. But then, because the cells are large, do you understand? They tend to be very fragile. So in trying to pass through capillaries, what will happen? They begin to rupture. And when they rupture, the cells will begin to reduce. Do you understand? Now the second one is macrocytic hypochromic anemia. Macrocytic Macrocytic hypochromic anemia. In macrocytic hypochromic anemia, the cells are large as well, right? The concentration is reduced. Hemoglobin concentration is reduced. Cells are large. Hemoglobin concentration is reduced. Here, the cells are large, but hemoglobin concentration is normal. Do you understand? Right. Then the fourth one is called microcytic hypochromic anemia. Microcytic hypochromic anemia. In microcytic hypochromic anemia, the cells are small, right? The cells are small. Because the cells are small. Okay, the cells are small and the hemoglobin concentration is low. Do you understand? The hemoglobin concentration is reduced. The cells are also small. Do you get it? Any problem with that? Any problem with that? Any problem with that? You didn't get it? Okay, I'll repeat it myself for the last time so that you get it. But you know the types of anemia that we have. The types of morphological classification of anemia, right? Pneumocytic, pneumochromic, macrocytic, hypochromic, microcytic, hypochromic. In pneumocytic, pneumochromic, the cells are normal. They have normal hemoglobin concentration, but the number of the cells are reduced. In macrocytic pneumochromic anemia, the cells are enlarged, but the hemoglobin concentration is normal, right? Now, because the cells are enlarged, they tend to be fragile. When they pass through capillaries, what will happen? They begin to rupture. And when they rupture, what will happen? The number of cells will begin to reduce. The second one is macrocytic hypochromic. Large cell, but low concentration of hemoglobin. Do you understand? This one is microcytic hypochromic anemia. We have small cells, the size are small, the hemoglobin concentration is also right. A typical example of this one is it occurs in iron deficiency anemia, right? This one occurs in megaloblastic anemia. Are you there? Can we continue? Now, based on etiology, anemia is classified into five types, right? Into 5 types. The first one is called what? The first one is called hemorrhagic anemia. Or if you don't call it hemorrhagic anemia, you call it what? I say hemorrhagic. Hemorrhagic. Should I spell it? Hemorrhagic. I will spell everything a bit. Hemorrhagic anemia. Hemorrhagic. Number one, based on etiology. Number one is what? Hemorrhagic anemia. If you don't call it hemorrhagic anemia, what will you call it? You call it blood loss anemia. Hemo what? No, thank you. Hemorrhagic, right? Hemorrhagic. Are you there? The second one is called hemolytic anemia. Hemolytic anemia. The third one is called what? Aplastic anemia. Aplastic anemia. The fourth one is called what? Nutrition deficiency anemia. Nutrition deficiency anemia. The fifth one is called what? Look at me, the fifth one. Somebody should tell me the fifth one. He said anemia of what? Chronic diseases. Anemia of chronic diseases. Are you there? Now, when we talk about hemorrhagic anemia, we are talking about anemia that occur as a result of what? Loss of blood, bleeding. Are you there? Anemia that occurs as a result of what? Bleeding. Right? It could be acute bleeding or chronic what? Bleeding. Are you there? For instance, people that have hemophilia, right? Hemophilia purpura, right? And what else again? The bleeding that occurs as a result of peptic ulcer. Are you there? Even accidents can cause acute hemorrhage. Right? You know, we have 2 types of hemorrhage. We have acute hemorrhage and chronic what? Hemorrhage. Acute hemorrhage is when you lose a lot of blood, right? Within a short period of time. Chronic hemorrhage is when you lose blood little by little over an extended period of time. Are you there? So hemorrhagic anemia or blood loss anemia is the anemia that occurs as a result of what? Bleeding, right? Or loss of blood. The second one is hemolytic anemia. Hemolytic what? Anemia. Hemolytic anemia. Hemolytic anemia occurs as a result of the breakdown of aerobicis. Are you there? The lysis. Beta is for adults. Gamma is for what? Fetal what? Hemoglobin. For fetus. Right? 2 alpha and 2 what? Gamma. For sickle cell. Are you there?
Check my bag.
Right? Are you sure?
That's tonic.
Adult is 2 alpha, 2 beta. Fetal is what? 2 gamma. But we are talking about simple cell anemia, not fetal. We are talking about yes, sickle cell anemia. We are not talking about fetal hemoglobin. Fetal hemoglobin is what? 2 alpha, 2 what? Gamma. Right? Can you hear me? Are you following? By the kidney, some go out to the world, large intestine, right? And brings about the proud call of what? Feces, and that's what we call what? The staple what? Gene. Do you understand? So for when the bigger white blood cells, I have satisfied my conscience. We have done analysis. So let's talk about white blood cells. When we are done with white blood cells, we go to immunity. When we are done with immunity, we talk about other things. Hemostasis, ABO, blood group. I will try and make sure I finish it. I'll finish it by the grace of God. If I can't, I will try. But go and listen to my videos on erythropoiesis. I have videos on erythropoiesis, right? Go to my channel and watch it. Erythropoiesis. All right. So white blood cells are what? The nucleated element of blood. They are what? The nucleated element of blood. You know, we talked about RBC, red blood cells. I will say that they are not white blood cells. We have plasma here. Is it also? The whole of this is what? Red blood cell. This is puffy cross, which is about 1% that contains what? Both white blood cell and what? Platelets. You can see they are small in number, very small, but in terms of size, they are larger in terms of size than what? Red blood cells. So that's the difference, right? And they are nucleated. They contain what? Nucleus. Are you there? They have nucleus in their cytoplasm. Do you get it? All right. So now let's talk about the classification of white blood cells. Now, based on the presence of granules, based on the presence or absence of granules, based on the presence or absence of granules, based on the presence or absence of granules, white blood cells are classified as granulocytes and agranulocytes. What did I say? Based on the presence or absence of granules, white blood cells are classified as what? Granulocytes and agranulocytes. Can I claim this? Then the next one is called what? Basophil. Basophil is what? 0.4%. Right? Then the next one is called monocytes. Monocytes is what? Monocyte is 6.3 what? No, sorry, 5.3%. 5.3%. Then the next one is called lymphocytes. Lymphocytes is what? Is what? 30%. Right. So you can see 62% of this value is neutrophil. 2.3% of this value is eosinophil. 0.4% of this value is what? Basophil. 5.3% of this value is monocyte. 30% of this value is what? Lymphocyte. Now from this percentage, right, you observe that we have more neutrophils than other what types of what? White blood cells. followed by what? Lymphocytes, followed by what? Monocytes, eosinophil and what? Basophil. The least is what? Basophil. Do you understand? So I can twist my MCQ. What is the least? Which white blood cell has a least percentage or number, right, in the body? I can twist it. I'm telling you how. I'm telling you how I'm going to set my. All right. So you have this. You know this value, right? You have these values. You know them now. Do you know them now? All right. So yes, ma'am. Yes, ma'am. Yes, ma'am. Of that value, yes, ma'am. Which value? It's a range now, so you put the value here, put 62% of it, 62% of it. We'll give you the range now. Is it also? It's a range. Is it also? 62%. 62%. Will you not give you the range? Can we go on? All right. So now we'll now talk about. Yes, sir. Yes, sir.
Like this, like all these like if you check some tests,
yes, you will see different ranges, but this one, if you look at what they call it, Sembulica, is it also that the one you like? That text would be like Sembulica will tell you is it like 20, is it 50 to 70? So it's 60% or 62%. It's not the same with what? Methylene blue of the cell, based on the age of the cell, right? With the age of the cell, we normally have large lymphocytes and small lymphocytes. Larger lymphocytes are the younger what? Lymphocytes. Yes, younger lymphocytes are what? Large. Older lymphocytes are what? Smaller. Based on the age. Are you there? Then, based on their function, we have two. Number one is T lymphocytes. Number three is what? B lymphocytes. T lymphocytes and B what? Lymphocytes. T lymphocytes and what? B lymphocytes. This one is based on function, right? The T lymphocytes are implicated in cellular immunity or cell-mediated immunity, whereas the B lymphocytes are implicated in what? Humoral immunity. The first one is cell-mediated immunity, right? Then this other one is implicated in humoral immunity. You know that it's my time will soon be up. Me. An increase. Now I'm talking about an increase in the number of white blood cell is called what? Leukocytosis. You see it in the FAQ. An increase in the number of white blood cell counts, right, is called leukocytosis. That is to say that when this number increases beyond 4,000 to 11,000 per cubic millimeter of what? Blood. We call it what? Leukocytosis. Leukocytosis. Decrease in that number. Leukocytosis. Right? That is an increase in the number of what? White blood cell count. Total white blood cell count is called leukocytosis. A decrease in the number of white blood cell, total white blood cell count is called what? Who can tell me? It is called leukopenia. Do you have another lecture? Yes. Where do you have it? Over there? Yes. Which lecture do you have?
Anatomy.
Well, some students don't have. We call it leukopenia. Are you there? Now, there are conditions that actually increases the number of what? White blood cell. There are conditions that either increase or decrease. Physiological conditions. For instance, age. Right? Age. I think children tend to have more white blood cell than what? Adults. I think so. Right? Children tend to have more white blood cell than adults.
Yes.
In pregnancy, pregnant women tend to have more white blood cell. Right? During menstruation, women that are menstruating tend to have women that are menstruating tend to have what? I'm talking in terms of variation, right? Variation in the number of what? White blood cell. Pregnancy, pregnant women tend to have more white blood cell, right? Women that are menstruation, right? They tend to have more at that point. You have more what? White blood cell. When you are menstruating, the number of your white blood cell will what? Increase. Are you there? Pregnancy, variation, parturition. During parturition, that is when you are giving birth to child. Parturition means what? Birth, giving birth, right? The process of giving birth is called parturition. When during parturition, the number of white blood cell what? Increases. Are you there? The number of white blood cell what? Increases. Environmental temperature increases white blood cell. Increase in environmental temperature, right? Increases white blood cell. Duodenal variation. You know what we call duodenal variation? Duodenal variation. In the early morning, right? In the early morning, white blood cell is normal, but around, let's say in the afternoon, right? The number of white blood cell what? Increases. The number of white blood cell increases. Duodenal, D-I-U-R-O-N-A-L, duodenal variation. You know them. You know them. Go and look at them. Then we also have, this one is physiological, right? This is what?